How long does it take for spironolactone to start making acne better? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute. We're an acne-only dermatology practice, so we specialize only in treating acne, and we like to offer our insights and our experiences for acne sufferers who are navigating the path toward clear skin. And we hope you find it useful, but this is only for educational purposes. It is not meant to be medical advice. So how long does it take for spironolactone to start working for acne treatment? So that's a common question. Spironolactone is a great medicine for acne in women. It's only used in women for acne. And the way it blocks certain acne-causing hormones, this medicine could have certain side effects on male patients. So we use it exclusively for women when we're treating acne. Now, how long does it take to see results? So it depends. So the first thing to consider is spironolactone does not work for everyone. There are some women it just doesn't work for. As a matter of fact, there are some women who take spironolactone and begin to have a flare-up. Their acne starts to get worse fairly soon after starting the medicine. But thankfully, the majority of women that we treat with spironolactone actually have a good response. So how long does it take to see results? That depends. It depends on the degree of acne that they have. It depends on their response to the treatment, because each individual patient can respond somewhat differently to any treatment that we use. But on average, it can usually take a few months to really start to see decent results. Now, that's taking into account that the patient is on the right regimen for the treatment and that the patient is consistent with treatment. If the patient is on the appropriate dose of the medicine for their circumstances, it depends if the patient has been taking the medicine for a long enough time, because some patients expect to see results right away, and that's typically not the case with spironolactone. At Advanced Acne Institute, in our experience, the way we use the medicine, there are some patients who begin to clear up right away, even at a starting dose of the medicine, but there are other patients who need tweaking of the dose, and they need more time. Now, when we do see an effective response, we typically see that within 2 to 3 months, where we start to see the signs that spironolactone is going to be working well. And sometimes it can take longer than that to start to really get the final results of completely clear skin that we try to obtain when we use spironolactone. That's typically our goal with this medicine. Now, when we do see a good result, sometimes we can see the changes occur almost in slow motion. So for example, if somebody has very inflammatory acne with a lot of inflammation, a lot of redness, and we use spironolactone, sometimes we see what I refer to as a melting away of the acne breakouts and of the inflammation. And what I mean by that is that we start to see little by little things get better. So the redness might begin to get reduced, and breakouts might slowly begin to resolve. And if there are large areas of breakouts, they might begin to reduce in their inflammation. So it's like a melting of an ice cube, slowly but surely. And we see that in many of our patients that we treat with spironolactone. So we look for those signs when we have a patient under treatment, and we sometimes can modify the dose. Sometimes we can even reduce the dose as things begin to show good signs of resolution. And so it's a treatment that we're always monitoring, and we're looking for ways of tweaking the treatment to make it the most effective treatment for each of our patients. But overall, it's a treatment that requires some patience. You can't expect it to work right away in most patients, and it requires the regimen to be appropriate for each patient's particular circumstances. And eventually, most patients respond well, but there are some that just don't tolerate the medicine well or don't respond well. And so it's not a medicine for every patient, but it is a very effective tool for women with acne breakouts.